Hi guys, today I'm going to talk about HIV in youth populations. Just a quick overview for both. When I say youth populations, I'm describing them as 13 to 24 years of age. HIV stands for Human Immune Deficiency Virus. HIV attacks the body's immune system, which is your T cells. These T cells help the immune system fight off infections, which is many times what causes such sickness in HIV/AIDS diagnosis. In 2014, there were estimated 37,600 new HIV infections in the United States. HIV can lead to the acquired immunodeficiency syndrome, or AIDS, if not treated properly. And there's currently no cure for HIV/AIDS, but early treatment in HIV can stop the progression to AIDS. Just some quick history. In 1981, a rare lung infection was published in the medical journal as a growing problem in the United States. This would later be revealed to be the start of HIV/AIDS. This would also mark the start of the HIV/AIDS epidemic, which ran mostly through 1980 into 1990s. By the end of 1981, a total of 270 cases were reported, and 221 individuals had already passed due to the disease. In 1987, FDA approved the first antiretroviral drug, AZT, which was the first line of defense against HIV progression to AIDS. In 1992, AIDS was named the highest cause of death in men 24 to 44. And in 1995, President Clinton hosted the first White House conference on HIV and AIDS. On to HIV in youth. In 2016, youth ages 13 to 24 made up 21% of all new HIV diagnoses in the United States. 8,451 youth received the HIV diagnosis in the United States. 81% of those diagnoses occurred in people ages 20 to 24, so that's your college age population. 1,473 youth received an AIDS diagnosis out of that 8,451. At the end of 2015, an estimated 60,300 youth were living with HIV in the United States as a total. Of these, 51% were living with it undiagnosed. That is the highest rate of undiagnosed HIV in any group. By the end of 2015, 11,600 people were living in America had HIV acquired from perinatal transmission. Perinatal transmission is the pass of HIV from a mother who has a positive diagnosis to her unborn child during pregnancy. Numbers by the ages in 2016, 13 to 14 had 23 new diagnoses. 15 to 19, 1,652. 20 to 24 had 6,776. 25 to 29 had 7,964. And 30 to 34, 5,701. You can see after the 25 to 29, the numbers start to go down. 20 to 29 had the highest amount of new cases in 2016. And some of these causes can be inadequate sex education, risky behaviors, socioeconomic challenges, high rates of sexually transmitted diseases, stigma about HIV, and the possible feelings of isolation. All of these can be combated against education. Teaching the proper materials can be the main way to go against a lot of these causes for why these numbers are so high in the youth population. As I mentioned in the previous slide, a cause could be the stigma surrounding HIV/AIDS. A musical and movie was produced in early 2000s based on the 1989-1990 time period, which was the high point of the HIV/AIDS epidemic. In this musical, there was multiple individuals of the main cast that were diagnosed with HIV/AIDS, and the musical was able to follow them throughout the shooting of how they were combating against this disease and what their characters were going through. They had one song called Will I, which depicts a support group for those living with HIV/AIDS and expressing their emotions of how this disease affected them and how individuals were viewing them in the general population. Many individuals diagnosed, both adult and youth, feel a sense of isolation and judgment from those around them. The current challenge is to break the stigma surrounding HIV, that it doesn't define your life and that you don't become your disease. When it comes to solutions for HIV, it is mostly education. Teaching the proper material and proper information is the main way to break stigma and to get people acting aggressively against this disease, getting tested, having conversations with their partners, having schools adding curriculum around the age of 13 just about safe sex practices, programs that they can go to get condoms, to get testing, to get support if they do get a diagnosis, and anything else that they need. Teaching them how to talk to partners about getting tested, the importance of it, making sure they know that you should have that conversation, that it's not weird to have that conversation, that it's important for both you and your partner to have that. Giving awareness of the treatment methods for those diagnosed and the options available for having a normal life. Today there are more treatment methods for HIV than ever before. People are living completely normal lives with this disease, keeping it completely manageable. And there are additional information for partners of those with HIV positive partners. There are medications that they can take, PrEP, for example, that keeps them HIV safe while still having a normal relationship with their partner. Educating younger ages about the reality of HIV/AIDS allows them to grow up making smarter decisions in regards to sexual activities, as well as changes their mindset of future generations on their opinion on HIV. Making it a normal conversation and taking away some of that stigma makes it so that these generations grow up not thinking that their life is over with an HIV diagnosis. There's also socioeconomic problems that pose a threat for those who need to get tested or treatments. Many of this age either don't have insurance or they're still living under their parents' or guardians' health insurance, and they can't do testing or anything like that without them knowing. So getting free and confidential testing and helping them get there is a main problem, is a main goal for any program. The next step is to actively offer resources needed for these younger individuals to get tested, treatment, and support alone before forcing them to share. Having these programs to help the individual alone before they call parents or guardians or friends and family is important. Sharing an HIV/AIDS diagnosis is a big step for someone in their life, so having the support alone is important before they go public. These resources should be promoted through local high schools, middle schools, college health offices, as well as local health departments and organizations. Any way to get this information out is helpful. You never know who it could reach. Providing free and easy confidential resources gives options to those who might think that they have none. When it comes to the youth population, the best option out there is to provide them with as much relative information as possible and following up with resources that they can take advantage of and get the help that they need. CDC reported that only 1 in 5 sexually active high school students have been tested for HIV. That number needs to be higher. They need to know that there's a danger in not getting tested and know that there's treatment possible if, for God forbid, you do get this diagnosis. An estimated 50% of young Americans who are living with HIV don't know that they are infected. This is just a short video about a individual getting diagnosed.
I was diagnosed on October 25th, 2010. I had noticed, there was something off about my body. There was something weird going on. So I took my boyfriend at the time into Planned Parenthood to get tested. And he came out 15 minutes later, his face white, and he was holding papers that had information about HIV on it. And we were in the waiting room, and there was a bunch of people, and he said that he tested positive for HIV. I knew. I took my diagnosis at that time. My first reaction was, I'm going to get through this. I'm not going to let this define me. I'm going to be okay. I was just determined to make that happen. The positive attitude is definitely, it goes a long way, because she could have just, there are people who don't fight and give up and decide this is my fate and I'm just going to let it control me and let it be. And she was like, I love that. The story, when she first got diagnosed, the first thing she said is, this will not defeat me. This is not something that I'm going to let control me.
I'm so proud of myself.
Yeah, and
I didn't even know where it came from. It came like, I chose to support this campaign because I agree with the message. I want to decrease stigma and increase awareness.
If I could say something to people who don't know anything about HIV, and I just, especially people our age, in our 20s and 30s, like, it's really about time to really do our research, because if I didn't know Kelly, I would still be ignorant to HIV. She was just like an average person, and I guess I just stereotyped the idea of people who have HIV, and I felt very enlightened. To be a positive support, you need to understand that you will never know exactly what the other person is feeling, but you need to always be there for them. My best friend has HIV. That does not define who she is.
Get back, get tested, get involved.
So you could see that she was fighting against her diagnosis and wanted to create a stigma-free world, and that her diagnosis wasn't who she is, and that doesn't have to be who she is, or doesn't have to define what her life is like. 5 positives to care for HIV positive treatment. There's choices. It's never a one-size-fits-all. There's always multiple treatment methods that you can go through, and you have to, it's kind of a trial and error situation for certain diagnoses. Safer sex, birthdays. I like the birthdays one. It's stating that the longer you go in care and the faster you get treatment, the more birthdays you're going to have. There's also options for people who want to start a family. These actually can, I mentioned before, perinatal transmission. There's actually ways to go through a pregnancy without transferring it to your fetus, which is great that hasn't always been like that. And Hope, it was stated in the video, she had a positive outlook right from the beginning, and as her friend said, that positive outlook goes a long way. You get in care, stay in care, and live well. HIV does not define you. This is a part of Act Against AIDS and HIV treatment that the CDC has. It's all about making sure that you find care, stay in care, and live well, that you get tested right away, you get your treatment right away, and then you keep up with it and keep working the program that your doctor has set for you. And that's all, and I really thank you guys.